May say Obamacare makes sure that uninsured Americans have quality health insurance equal to the members of Congress and will have a good financial outcome while helping millions of people. But we disagree. I think that there are many negative outcomes of Obamacare. We spend too much money on inadequate health care, and Obamacare has misled us. People will have to purchase government-insured health insurances, and if you don't comply, it's coming out of your wallet, since they will give you a fine. And Obama has told us that his new health care will not affect you in any way, even though it's proving wrong. And not only that, but overall, Obamacare has very unacceptable ratings. In its first major attempt to rank healthcare systems, the World Health Organization's 2000 placed the U.S. healthcare system 37th in the world. This called into question the value Americans receive for their investment in health care. The U.S. ranked 24th in terms of health entitlement, even lower 32nd in terms of equity of health outcomes across its population, and even lower 54th in terms of fairness and financial contributions toward health care. If you want a good health care, then why would you choose the 37th best? Well, you wouldn't. And to add to that, Obamacare is supposed to be not as expensive, and it is not as expensive and affordable compared to other insurances, but considering its 54th in financial fairness, that doesn't sound that cheap. And as Abby Miller from Dance Moms would say, if you don't come in first, you lose. So why would you like to lose your money with a destitute health care? So overall, Obama lied to us about being affordable health care or even a good one. And the government is blowing through money to get its health care established that people who didn't subscribe to this will be paying for. In the end, Obamacare will not only damage the people but also the government. It will have a positive outcome. It will not have a positive outcome for either of us, so it can only hurt us as a country, not help.
My opponent says that the upper class shouldn't have to pay for the lower class, but we disagree, because it is proven that the global upper class makes 32 times as much as the lower class, meaning even if they have to pay, it's not going to affect them much. They have enough to pay for the lower class and not help those. Why would you not help those in need? Therefore, the payments made by those with so much benefit those with so little.
My opponents have said that the Affordable Health Care Act is useless and not dependable. My teammates and I conclude that the Affordable Health Care Act is an important factor to everyday life. That's why we shouldn't take the benefit away from people. Coming to America allowed people freedom and equality. It's not equitable if people aren't eligible to have health care insurance because they're lower income. That's like when the Nazis exterminated Jewish people because of their religion. That's who they are. As if not us providing health care insurance to lower and needy Americans because of who they are. The Constitution says all men are created equally. Then why are we not allowed the same health care benefits? According to CNN, businesses that have roughly 99 employees or over, 70% of them are covered with proper health care insurance. And by 2015, that 70% will become a 95% if we follow through with the Affordable Health Care Act. If Americans need help to carry on their lives and to have some sort of assistance to recovery from such problems as such surgery, home health care, accidents, emergency troubles, healthcare shouldn't be over the top expensive. In the words of ObamaCareFacts.com, it says the most important fact to know, and I quote, most importantly, affordable health care, law of the land. There are many people who like to see the Affordable Health Care Act repelled. If the Affordable Health Care Act is repelled, tens of millions of Americans would go without proper health care insurance. And insurance companies will continue to be able to deny pre-existing coverage. Without health care to reform America, it will continue to suffer the consequences, whose bottom lines are profit and not health. And I quote again, over 100 million Americans have benefited from the new health care law. This includes more than 105 Americans who have accessed critical preventive services for free that have previously been subject to out-of-pocket costs. Billions of dollars have been saved for the seniors for the gradual closing of Medicare, and billions saved for new accountable measures for insurance companies and much more. If so many people are already locked into the system, then why should a small group of people be able to say no to the Affordable Health Care Act, just because of all the power they have? This subject shouldn't be a dictatorship. This is America. We should be able to fight for something we all want and something we all need. After all, this is our lives we have to care for. Why stand in the way of people trying to better care for themselves and better care for others? Following through with this Affordable Health Care Act will not just benefit most Americans, it will benefit all.
My opponent says all coverage from Obamacare is benefiting people with essential health benefits, but Obamacare is hurting other health cares. Obama himself said that if you like your health care, you can keep your health care plan. But millions of people have already been dropped from their health care because Obamacare is raising everything. Millions of people are losing their jobs, losing their health care, and some are even shutting down. If you like your insurance, you should be able to keep it. But the government went against Obama's promises. Dropping people from their health care is just raising more work for the government himself. It's adding more people to the plans, so I don't think that's working out. Therefore, Obamacare is just hurting other health care insurances.